Well, that's what happens when you go to the
You know, I
beach.
don't get nervous at this point in my life.
Yeah.
Hello, everyone. Thank you so much for joining us this morning for another FaceTime session with Dr. Gerry Samson and our guest today, Dr. Kevin Donnelly. I'm so excited about the content that we are going to dive into today on fluoride controversy. If we haven't met or if you haven't seen one of these webinars, my name is Allison Farrell. I'm Fireside's Director of Marketing. And if you don't know what Fireside is, I wanted to give you just a quick overview. So we are a growth as a service solution. So we help pediatric dentists specifically grow profitability. And we do that through a couple different things. We do have cost savings that are delivered through group purchasing on clinical supplies. Automation. So we have a purchasing platform where it makes it super easy and you save time doing all of that supply purchasing. And we are in process of developing an AI purchasing agent. And then education, so personalized member support and tailored content, just like these sessions that you're joining today. What does it look like to be a member of Fireside? Our dentists typically and practices typically spend about an hour a month purchasing supplies, versus that can look a lot more in other practices. We typically see about 21% or more savings on those supplies, and we have technology that fuels price transparency. I won't dive into our full platform. You are welcome to schedule a demo with our wonderful Director of Sales, Matt Kinback. I'll send out information on how you can do that. But what we do see is that, against market, we are consistently coming in lower on supplies like gloves, Simply Shade, Cavi wipes, all of the things that you routinely buy. Even some of the materials that we're gonna dive into today. We've got savings really across the board. We have about over 75,000 products from manufacturers that you know and work with today. And we don't offer any gray market products, but you can see some some familiar names on this screen. But ultimately, what we see compared to major suppliers are pretty significant savings for our practices. So compared to kind of the big three and Darby, we see pretty consistent savings in that 20% range. So that is about all I'll share today. Just wanted to give a quick snapshot of what Fireside is. We have a lot more that we offer our pediatric dentists and practices, including content like this. We have more solutions that are kind of in the pipeline to come. But it has just been a joy getting to know and work with the practices that we have that are members. So if you are a Fireside member, we are so excited that you are here today and enjoying this content. And if there's anything that we can do to help, Rachel, your girl, there she is always available if you need her with supply purchasing help or just anything with your membership.
Is she really that happy? Is she happy? She really
She
looks
is,
happy.
and she's a former dental hygienist, so she knows the dental world. She's
Oh no, once a dental hygienist, always a dental hygienist.
very true. She will always a dental hygienist, but she's worked in dental offices her whole life basically. So she is well versed and familiar with all of the ins and outs of purchasing and has really been so instrumental in helping our members realize the maximum savings and efficiency that they can.
Well,
So
20% average, that's good money. I mean, if for those of you that heard Michael Schwartz here, it was the last fireside that we did. He was all over the fact that if you're not paying attention to your business will go away. Uh, Kevin Donnelly he's at the beach right now, which is why his allergies are bothering him. I actually thought he was so moved that he was moved to tears to be on here with Allison and with me and with Fireside. But no, he'd gone to the beach and he's allergic to palm trees.
All
Kevin,
in.
pa pollen trees. So I can't imagine if you're a pedi. And by the way, Fireside are pediatric dentists only. In case you didn't catch that part of it, you should realize, and you're welcome to continue to listen in. Nobody's going to be looking at you through the camera saying if you're not a pediatric dentist, you shouldn't be on this. No, that's fine. But membership is for pediatric dentists only. Kevin Donnelly, if you don't know Kevin Donnelly, you might not know what he looks like. You do now, but if you don't know his name, I would say anywhere in the world, I'd have to say, you sure you're a pediatric dentist? Um, Kevin, Tell us a bit about your background before you just launch into this fluoride thing. Um, because I think that people who are not that familiar with what your background is, think this is quite valuable to know. So, uh, you were the head of pediatric dentistry and orthodontics. You're a pediatric dentist, but you were head of both programs at University of Texas Health Science Center in San Antonio for how many years?
28 years.
28 years. And before that?
I was at the University of Iowa, and I started my career at the University of Texas Health Science Center at Houston. So I've only had two employers, University of Texas and the University of Iowa.
Mhm. Well, and in these years, now I did mention Kevin was the chair of both departments, which I think is confusing to people who may be watching this. Is well, wait a minute, but he's a pediatric dentist. He's not dual trained. And I'll say this for Kevin because he wouldn't say it himself, but the University of Texas Health Science Center at San Antonio had seen Kevin's rather remarkably impressive record in understanding how to have a very successful pediatric dental department in a very large university with multiple locations around San Antonio, including uh, satellite locations. And I know what happened was the dean said, well, the orthodontic department is not running the way we would like it to run. So, Dr. Donnelly, why don't you fix it? And Kevin just hired the right people and orthodontists to fix the department. All in, Kevin, how many? I like to ask you this, but I never remember the number. What was the total number of research grant money that you had during your career?
Oh, right around $42 million.
For
And about 80% of that was federal money and 20% was industrial money.
so you can see why the universities, from that standpoint, really had Kevin Donnelly in a place of high level of respect. But he also knew how to run this successfully within the university system. Um, Before I ask you about fluoride, uh, Kevin was very recently inducted into the Royal College of Surgeons, and if you're not familiar with what that is unarguably one of the highest honors that's bestowed on people in the medical and dental specialties. It's an extremely small percentage of dentists that are inducted into the College of Surgeons in Edinburgh. So they take it very, very seriously about who is a member. In your, as far as fluoride specifically, Kevin, um, what was your focus as you launch on talking about fluoride?
Well, I've done a lot of fluoride research, as you know, over the years, from fluoridated toothpaste and their effectiveness. When you throw a lot of things into toothpaste, some things shouldn't be thrown together because they chelate out. And so that's not good. So I've done a lot of that. I've done a lot of preventive agents. And I guess I call myself a carriologist because I also took it all the way to the final product of randomized clinical trials. And there's not a lot of dental clinical researchers in the world, actually. And so it was quite fun, actually.
Um, Now, when it comes to this fluoride controversy, typically the way these things go, having all of us have sat through or been subject to a lot of these things, well, they go through a history. And then there are people in the room that are thinking, people like me will think, well, look, if I didn't respect your expertise, I wouldn't even be sitting in the room. So I'm quite enthusiastic myself about cutting to the chase. That being, all right, a lot of dentists in general are really, they're up in arms and ready to grab the torches and storm the castle over RFK Jr.'s apparent throwing down. And some people think he's actually saying fluoride is just evil and horrible. Um, what do you think about that, Kevin?
Well, as you and I have talked about, Jerry, I've been in this a long time, so this isn't the first time I've seen fluoride thrown under the bus. When I got to San Antonio, actually, it was the largest city in the nation that was not fluoridated.
Really?
And yes,
I
and
did not know
we
that.
got it fluoridated. A lot of help from Ed Garza, who's the mayor, and the city council, and they all supported fluoridating the community water supply. And so I think that this isn't just a short-term thing. This has been ongoing forever with people that believe in fluoride and those that don't. And so I guess the way I feel about it, Jerry, is I just say follow the science. You know, what is factual, and that will take you to your final decision.
Well, how about these statements that fluoride causes all of these problems, everything from autism to bedwetting to sleep apnea. I mean, whatever is being said. Again, I think is if we claim to be doctors in pediatric dentistry, if that's our claim, then we are obligated to follow whatever science is there, which would be following the scientific method and published in refereed literature. You know, not the journal of what's happening now, not the journal of why fluoride is evil, not the journal of I hate the current administration, so I hate them all. No, that is not science. So we're obligated to do this, and then we are obligated to give the parents accurate choices. Accurate choices. We cannot tell them what to do. So, in that realm about this thing about fluoride causing all of these uh, problems, what does the science tell us about that?
Well, I think that the American Dental Association and the American Academy of Pediatric Dentistry has taken each one of these factors and gone to the literature, to what's been said, and for anything that really has mounted as far as being anti-fluoride, they've given a response. And I've been a part both of the ADA responses and of the AAPD responses. And basically, the science that they cite is unremarkable. In fact, the one that said kids that are exposed to fluoride have lower IQs.
Yes, that one.
Uh, that
That
is
would have been me. I must have had a lot of fluoride. I
that's
can tell.
absolutely not true. And the funny part is when it gets into the papers, it's like when I was teaching the residents, don't try to get by just reading the abstract. You have to read the whole paper. And so I don't necessarily blame the authors of these papers because they come clean in the discussion section of what the downsides are, what the problems were with their research. And they were significant problems with them. And we brought those to everybody's attention again, just like the author did, and said that this is not true. And overwhelmingly, the true randomized clinical trials uh, support the use of low dose fluoride.
Well, there you have it. Now, the other thing is that I think everybody has to remember, and we all know plenty of people like this, and in each individual's own way, you recognize the statement that facts do not change people's behavior. That is not what happens. Well, what the facts are, what the science is, what changes people's behavior is emotion. And this fluoride thing has become a very emotional thing. So, especially, well, social media, the legacy media, it's more dramatic to throw down on fluoride and say these things, with an authoritative tone of voice and a fancy background, that these things cause these terrible problems. And you're saying equivocally, did I understand you that the scientific investigation does not support these wild claims of harm? Is that correct?
That is correct.
So, what what else can you tell us from your standpoint, having done the research and reviewed all this, a lot of literature? What else would you like people to know about fluoride generally, good versus not so good versus we don't know?
Well, I'll start with the good because overwhelmingly that's what the true scientific literature shows. Peer-reviewed, randomized clinical trials or meta-analysis, which really provides the quality of that data, overwhelmingly says that fluorides, whether it be in toothpaste, whether it be professionally applied, are better than not using fluoride. And I'm telling you, the literature overwhelmingly supports that. The World Health Organization, in fact, says that placing fluoride in toothpaste is the largest benefit on chronic diseases that has ever been done. And
Oh,
I think you know that dental caries is the number one chronic disease in the world.
well, now I think again, for those of you watching this, there is the nugget or one of them that you're looking for. The World Health Organization, would you just go ahead and repeat that? They could rewind and watch the video recording, but would you repeat that? Because I think when presented with respect, and compassion to parents, this is the way I would put it is I am obligated to explain some things to you for your consideration. So would you repeat? That's how I would introduce it. So would you say that again?
Well, yes, the World Health Organization has identified the addition of fluoride to dentifrice as the number one best preventive method that's ever been introduced to fight chronic disease. And the number one chronic disease in the world, most prevalent, is dental caries. And you said something that's really important there, Jerry, is it's a dentist's responsibility to explain these to parents. Parents may come in and they don't want fluoride, and that's their choice. But you are liable if you don't tell them the benefits of fluoride and guide them to the literature where they can educate themselves. They might not do it, but you have the responsibility as a professional to tell them. And wouldn't it be sad if someone threw a lawsuit at you saying, well, I didn't know denying fluoride would hurt my child? Well, my dentist didn't explain it to me. So you really need to document that you did explain this, that you did give them things to read, and that you made sure that they understood what the riddance of fluoride would do.
Yeah, and you don't want to take that lightly because you don't want to be the canary in the mine shaft where the parent says, "You didn't tell me that." And I'm not an attorney. I'm not pretending to be one. But my understanding is that if you are accused of this by a parent about their kid that you didn't tell me, you will have to prove you did. It's
And
it's
you're liable.
it,
Yeah.
it's very similar to you're guilty until you can prove yourself innocent. Now, what would that mean if you were explaining this like from the bottom up, Kevin? What would that mean in a private practice as far as explaining that to the parent? What would you document that they were told? How would you put that, please?
Well, I don't know many things that move faster than pediatric dentistry, so you can't spend a half hour with every person who says, I don't want fluoride. So I think the easiest thing to do is verbally say, we believe in fluoride, our profession believes in fluoride, and these are the resources I'm giving you. Give them a handout of the websites of like the World Health Organization, the American Dental Association, and the American Academy of Pediatric Dentistry, and let them know that they can further research this if they don't believe you. But if you have this documented in the record that you routinely give this to people who deny fluoride, then I think basically you've covered your ass.
So if all you did, and I'm sure, look, your treatment coordinator or whatever, however those titles are going these days on the team, um, if all they did was say, well, let me give you these references, and the team member with document gave Mrs. Fanyat's fluoride reference sheet and told her to research further. That's it. That's all you have to put in the record. That is
Number
all.
one, you explained it so they could understand. So you say, this is vital, we believe. And two, you give them a reference sheet that then they can go explore further. If you routinely do those two things, it'll be a hard time for anybody to take you to court.
Well, yeah, they might they might try, but it wouldn't go anywhere. So
Correct.
the way I put these things in private practice, and it was not about fluoride, but it would apply directly, I think, is the first thing I would say to parents after I introduced myself and thanked them for coming in today and bringing their kid. Thank you for bringing your juvenile delinquent to me today. Um, the the next thing I would say was, what I'd like to do is explain things without confusing you. Because what I'm here to do is to give you enough information so that you can make a decision about what's best. Bang! I said that to everybody every time. And isn't that what you would want to hear, Kevin? You go to the physician, isn't that what you want to hear?
You're darn tootin'.
So I think that's extremely powerful to work with a team member that they say that. Maybe they want to say it a little differently, but that's going to get them listening. Now, what about the parent says, well, look, I don't care what these references are. That's fine. Thank you very much. But no, well, we're not doing fluoride on my kid. We're not doing it. What would you say to
I
that?
mean, that's certainly the privilege, I guess you could call it, of a parent to choose what they're going to do for their kids. You have to advise them on what you think is best and document that you advised them on that. Now, I wouldn't release everybody who says they don't want fluoride from my practice because there's so many now. But I think it's our responsibility to explain the benefits of fluoride, the detriments if we don't use fluoride, and that we make it clear where we stand and that they have now chosen themselves not to do it, and that's got to be documented in the record.
Now, one of the things that a parent can say in any circumstance, that any patient can say under any circumstances is, well, I didn't understand that. That's all they have to say is now you have to prove they did. So my point is, I know that there are any number of visual enhancements, visual aids that are not photographically, they don't need to be enhanced, of caries where they can, this is what we are trying to prevent. Now, I think what's ethical, and you show them a picture. And I think if you want to, and I think that's real smart, is you give them a picture. Just print them out and hand them out like M&Ms. I mean, sugar free, of course, but just start handing those babies out. And if it is in when it is in the record that the parent was given the references and they were shown a photograph and they were given the photograph, and you could call it photo uh, uh, DP1. That would be dumb parent one. And you give them this photo. Now, how can the parents say they didn't understand if you gave them this is what we are trying to prevent. Now, you still have to have a very good, consistent oral hygiene. You have to use floss, but fluoride is essential in the battle against this dental disease. Now, and then I'll shut up after I say this. I want to give credit where this is due. The first time I ever heard anyone emphasize the term that decay or cavities, that is a disease. And that was from Martha Ann Keels. And her rattle is, you need to tell parents use the terminology that's accurate. We are trying to prevent, we used to call this decay or cavities, but we now know it's a dental disease. And we are trying to prevent this disease, and fluoride is essential. What do you think about all of that, Kevin?
I think it's absolutely critical that you do it. I agree with Martha Ann. I think most dentists would agree with Martha Ann that we know that the backbone of prevention focuses around fluoride, and that parents need to be aware of that. You're considered the expert, particularly as a pediatric dentist, and we have to relay that to parents.
Um, what about the, here's what I want to ask you. All right, so you mentioned about fluoride toothpaste.
Mhm.
How does that compare? Uh, let's say, for example, that's all a kid was using, and the parents said, no, 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 I don't want any fluoride treatments. We're not doing that. And then the team member says, well, for the record, I really am obligated to get an answer to this question. Are you going to use or not use fluoridated toothpaste? Do you have any information if all they did was use fluoridated toothpaste but had no fluoride treatments? And let's say there was no fluoride in the water.
Well, yeah, some countries that's true. They do
Right.
not have fluoridated water. We do. Mexico, of course, they provide fluoride in their salt. But there's some countries that really the main fluoride exposure is through dentifrices. And so that's why I think the World Health Organization considers it the most valuable thing that's been introduced to the marketplace because, face it, parents have to brush kids' teeth to get the bacteria off. And if there's fluoride, it's a win-win. If they brush well, the fluoride's uptaken into enamel. If they don't brush well, the fluoride's uptaken into bacteria, which affects its metabolism. And as the pH goes down, is re-released into the environment. So it's basically a win-win if you're using fluoridated toothpaste.
Just as a bit of review, how about infants, that are just getting there, or even, 1 or 2 year olds? Let's even say that. And how much toothpaste should the parent put on the toothbrush, just as a review from your standpoint?
Well, 20 years ago, this was going round and round, and basically for a infant is supposed to be what we call a smear layer on the top of a toothbrush, and it would be a small toothbrush, a child-sized toothbrush. And for an toddler, it would be a pea size, and we say pea size because people can relate to the size of a pea.
Is that like a tiny pea or an English pea? I mean,
It's a
I'm just
green
trying.
pea.
It's a what?
It's a normal green pea.
Or it could be, yeah, pea. It could be a black-eyed pea. Could be a red bean. Anyway, I digress. So, um, from that, there is, I've heard concerns, and I think that, especially when coaching parents about newborns, what is your particular take on, let's say, stick a 2x2 gauze and just wipe the kid's mouth out? I mean, give us a little bit of review on that. What do you think about all of that before there's even the first tooth that, yeah.
Well, I think it's fine to go ahead and use a gauze to clean the mouth. We know that there's mutant streptococci in the mouth shortly after birth, usually introduced by the mother. And so you can wipe it off, uh, although it's not causing a real problem at that time. As soon as the first tooth erupts, there used to be kind of a dual view of this. Half of the dental schools were teaching don't use it until past age 2, fluoridated toothpaste.
Because the
And
kid might
half,
swallow a lot of it. Is that right?
that's what they were concerned of. And
Okay.
half said do. And, no, the American Dental Association never really took a stand. Well, all of a sudden, an NHANES study was presented. And for the first time since post-World War II, that caries has been followed and incidence has, there was an increase. And the increase was in children 2 to 5 years old. So that's a big factor. And so if that's increasing, not a good sign. And the American Dental Association made the recommendation, this was in 2014, so it wasn't just yesterday, to come back and start brushing with the fluoridated toothpaste when the very first tooth erupts. And that's usually around 6 months. And think how little when you're using just a smear layer. That's hardly any uh, toothpaste. And I think Steve at Dare probably is most well recognized for the amount of fluoride from toothpaste that is swallowed, and it's about half what's there. Well, if you have a really tiny bit, like a half a milligram, that's going to be insignificant in the long run for what fluorosis would cause fluorosis. So even the American Dental Association, our mothership of dentistry, recommends that you start brushing a child's teeth or an infant's teeth when the first tooth erupts?
Well, there you have that one. I mean, it comes down to, whether it's a pea size, a lima bean, whatever, a chickpea, a garbanzo bean. It's a teeny amount. That's what it comes down to. I mean,
Right.
when I put toothpaste on my toothbrush, I'm really using a small amount, and it seems to me it's foaming up pretty good there. So a teeny amount. Um, what what would be your particular advice when a parent says, absolutely not, no fluoride, I'm not using, I'm buying water that doesn't have fluoride. There's fluoride in the water in my community. I don't want that. Absolutely not. I'm not going to do it. What would you say to that parent? What advice would you give?
Well, the first thing I would do is I'd ask him why. Is this from the press you're reading, or you actually believe that this is a harm to your child? And then I would say, well, it's your choice. However, I'm responsible to tell you that fluoride is a good thing for your child's teeth. It doesn't matter if it's in dentifrice or professionally applied. Children that have both routes have fewer caries, lesions, less disease. And it's my responsibility to tell you that. If you choose not to do that, that's your right. However, I think then you're going to have to fight even harder for things in the preventive nature that will clear the mouth of Streptococcus mutans, such as brushing with any type of toothpaste, whether it has fluoride or not, and maybe increasing the frequency that you do it so that you're getting the plaque off that can't benefit from the effects of fluoride.
So I think that the entire team needs to be on very firm footing with what the doctors want in the office, because you can't afford to create any confusion. You can't have a business where some of the people are on one side of the issue and the other people are on the other side of the issue. That is going to be a real bad image. So I think that it's important, and Kevin, I'd like to hear what you have to say, but I think it's actually critical to get everybody on the team together and talk about this fluoride controversy. And it doesn't have to be a long discussion. We all know that this is a very controversial thing that's not likely to go away, but as an office and as a culture, this is where we stand on it. And then you explain that. So what I mean by that is if a parent starts digging in their heels with a team member and saying, I don't care what these articles show. My nephew's autistic and I think it was fluoride. Okay. All right. Remember, belief systems rule, not its emotion. It is not fact. Well, I think then you, I'm giving you my opinion. I think the doctor better have a talk with these parents. I mean, I think that's the way to go as well. I I ran into this with x-rays. So the parent would say, I don't want any x-rays done. And I would say, well, then you and I are really on the same page because I'm around the x-rays all day long in my office. So I'm very concerned about this, just like you are. May I ask your specific concerns? And then I let them talk. And with fluoride, if I was in pediatric dental practice, general dental practice, or orthodontists could be asked about this as well. I'd say, well, what are your specific concerns about fluoride? And let them talk. And if it gets to the point for the team member listening to this, where the team member is thinking, okay, this person is really they're it's called stonewalling. They're not going to listen. I think you better have an office policy. Does the doctor need to come in and say, no, I know that Hepzibah was trying to explain some things to you about fluoride. Um, may I answer any questions? Now, that could throw a monkey wrench, a big one, into the workings of the entire day. So you need to figure out how you're going to do this. The other option is um, what I would say when it came to x-rays, Kevin, is I'd say, Well, this is your son, your daughter, and your wishes will be respected. Absolutely, in my office. But what you're asking me to do is something I'm uncomfortable with. And when it was x-rays, I'd say you're asking me to diagnose and treatment plan your child without the appropriate information. And there's a name for that, and it's called treatment below the standard of care. It's also called malpractice. But when it comes to fluoride, that is really not what we're dealing with. So, how would you compare those two things, Kevin?
Well, the first point you made, I think, is critical that you need to have your staff and you all on the same page. Um, I find that the most powerful thing I can say is I have three boys, and they all used fluoridated toothpaste from when their first tooth erupt. I brushed for them until they could do it on their own. Uh, all three of them have never had a carious lesion ever. And so I think it shows that I believe it's safe because I've used it with my children. All our staff members have used it with their children, and we all are in agreement that from the literature, that it's a good thing.
Well, and if you have a team member who doesn't buy into this, I think that they need, well, for me, but I've been referred to as the executioner without a hood. I think they need to look for another job. I mean, you can't
I,
have it.
I would agree with that. You have to all be on the same page with behavior management,
Yes.
and with your treatment recommendations.
X-rays as well. You have to be on the same page.
Absolutely.
Now, I think an option, depending on the culture of the individual practice, I think an option when it comes to fluoride, first of all, you have to say, I understand your concerns. And we're going to respect what your wishes are in this office. So if you want to pursue no fluoride at all of any type and buy non-fluoridated water, it's okay with us as long as I haven't confused you about the potential consequences. I'm not saying this is going to happen, this photo, but it's more likely. Now, if you're okay with that, and I want you to take this photo and think it over. And if it were me, I would have him sign a release. I would have him sign something, and I'm not aware. The American Academy of Pediatric Dentistry, I think, should have I don't know that they don't, but I don't think they do have a release, have a form. It's an informed consent form where the parent says, it has been explained to me, and I understand that the use of fluoridated toothpaste, fluoridated water, and fluoride treatments in the office, done professionally, have been shown to be the most useful thing in decreasing caries disease or decay disease risk, something they understand. I have chosen not to do that, and I fully understand the consequences. Boom, sign here, date it and sign it.
Well, I don't think that's a bad idea. I mean, we now separately, when we use silver diamine fluoride, we have a separate consent for that because it turns teeth black. And we have to make sure parents understand if we use silver diamine fluoride, the teeth will turn black on the carious areas. So we have a separate consent for that. We have a separate consent for behavior management. For instance, if we're going to use a papoose board, we have a separate one. And of course, we say it's safe to immobilize the child so their hands don't get in the way. It's a safe venue, but we still have a separate consent form for that. And we don't routinely do that with fluoride. We just note it in the record. But I don't think that would be a bad idea to have a form, Jerry. And we can scan that right into the electronic record.
Well, as the attorneys that I've known over these many years, their saying is always the same. You can bulletproof yourself as much as you want, or you can take as much risk as you want. That's up to you. And the comment is always, you would never be sorry that this was documented. You could be really sorry it wasn't documented. So at the very minimum, again, I'm not an attorney, I'm not a judge, but my understanding is if it is in the patient's record these days, this would all be computerized. Who explained it? When was it explained? And who was it explained to? Now, if it's a single parent, let's just pick a number and just say the mom has custody of the kids and the dad is somewhere orbiting somewhere, who knows? Well, my understanding is that if the parent is you need to know which parent is actually legally responsible for making the decision. But what I always said, and again, this wasn't about fluoride, but it's easy to bridge that in, is that is his father um, on board with the kid getting orthodontics? Well, I don't know, not really. Well, and his dad, by the way, is going to pay for this. Well, then what I always did is, well, I am happy to schedule a separate consultation with his father. Do you think that's a good idea? Oh yeah, the mom says that's a great idea because I don't want to be in the same room with him. Got it. But so he needs to call the office and schedule that visit. So I'm going to rely on you during your communication, whether it's email, text, smoke signal, or if you actually talk to him, I'm going to rely on you and I'm going to put that here that you will tell the dad he needs to call the office for an appointment. And I may as well tell you now that there'll be a cost involved for that appointment, for for a separate consultation. Well, how much will it be? Well, it depends on how much time it takes, but just have him call the office, and that it was all in the record. Now, again, and by the way, for those of you out there on the other side of the screen, I was never sued. I was in practice for essentially 40 years. I was never sued. I was never threatened with a suit. I never received a registered letter that I was being sued. I was never summoned before the state board unless it was to act as an expert witness on somebody else, not me. So I'm not telling you this because it happened to me. I'm telling you this because I don't want it to happen to you. Any comments further about that, Kevin?
Well, I agree. You can never have enough documentation. And, as a educator, I have to co-sign all patients charged that come from students or residents that I'm teaching. So it's my license on the line. It's not their license, it's my license. And so
Very good.
I'm picky about what is said in the record. And I keep reminding them, this is your legal document. And I will go to great extents to explain things. And to go a step further, Gerry, about what you were saying about talking to the parents separately or together, I think what also is important is when you have one parent putting themselves up against another parent on, uh, they don't believe in fluoride, and I do. Do you think that's, I should sue them? Well, that is not your problem. And you say, I think this is a benefit. I'd be happy to talk to the other one and tell them the benefit. But we need to get everybody on board on the same page.
Yeah, I agree. I had that come up not very often, but it came up, and I'd say to the parent, one time it was a dad. I remember that specifically, and I said, "Listen, I am not going to get in a position where I'm between you and his mother. That's very uncomfortable for me." So here, I think is the bottom line that some of you that have heard things like this before, especially from Kevin and or from me, is tell them to get some other opinions. Tell them, well, hey, I really do want you to get enough information so you can decide what's best. So I would really think it's a great idea for you to get some other opinions. No, 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 we don't want other opinions. I don't have that kind of time. Well, this is as far as I ever went. I'd say, I understand, but I'm going to insist you get other opinions before you make a decision about coming here and before I decide if this is a good match. Now, I only remember having to do that twice, but I did it because I thought, I don't know if I want you here. The other thing is to say, look, if that's how you feel about fluoride or x-rays or blood, whatever it is, well, we'll come back if the kid has a problem. Well, my take on that, not Kevin's, not any of the rest of you, is that I'm really not comfortable with that. So you really should see a different dentist. I'm not going to be able to meet your needs. And I just how I put it, I'm not going to be able to meet your needs. So you really should. Well, how am I going to find another one? Well, why don't you ask your neighbors? Or the old funny saying is just give them a few names of people you really don't like that are dentists in the community. But I did hear in a discussion one time with one of the attorneys. I don't remember if it was Larry Gerald or Don Mackin. I don't think it was my brother. They said, "Yeah, but if you give them the name of somebody who is really has not a good reputation, you're liable." I mean, they'll just say, "How did you get here?" Well, that moron Samson sent him here. Oh, really? Let's get him too. Now, it wouldn't go anywhere, but it would, I don't know about your personality, Kevin Donnelly, but mine is if somebody tries that with me, uh, I'm thinking, uh, let's see, how can I get even with this person? How far am I willing to go? So, uh, I think that my point there is that if you have dotted all the proverbial I's and crossed all the proverbial T's, and someone comes after you anyway, no matter what it is, no matter what, why would you beat up yourself when in fact you did the right thing? Why are you giving them the power to beat on you? And there are, the saying, like when it comes to fluoride or any of these other things, Kevin, well, I guess we'll agree to disagree. I mean, that kind of, I hate hearing that. It's so worn out. Um, I mean, Bob Dylan said, well, when you go your way and I go mine. I mean, I like that a lot better, actually. What other information do you think is essential for people in on this when it comes to fluoride generally? For example, where do you think this is going? Just as a prediction.
Well, I think, as you know, Jerry, I'm a consultant to the FDA, the Federal Drug Administration, and to the CDC, the Center for Disease Control and Prevention. And you probably know too that they've cut all the oral health entity of the CDC.
That's gone.
And yeah, and so I think where's it going? I think it's already there.
It's already
I
gone.
think they're making their points clear. They want to get rid of prescription fluoride, such as drops or tablets.
Wait a minute, wait. What, excuse me. They want to make that illegal?
Yes,
That's wrong. That is so wrong. That is so. This is the United States where you get a choice. You should have a choice. So you could choose no fluoride, or you should be able to choose fluoride drops. Now that uh, I didn't understand. That's putting me off the rails. I don't. I agree with the
right.
choice.
And these recommendations, when they come from Health and Human Services of the country, people tend to believe it. And so, I probably will not be called in the next 3 years because I'm an expert on fluoride and they don't want me, you know? And so I think as professionals, we step up to the plate now. And the American Dental Association already has, so has the American Academy of Pediatric Dentistry, and so has the American Academy of Public Health Dentistry. And we say, no, fluoride is beneficial. But now it's the profession standing by themselves without necessarily the support of the FDA or the CDC.
Well, again, I'm kind of stunned. I didn't. I'm losing my voice here over that. That's ridiculous to say that you can't buy fluoride drops. I mean, by the way, for those of you that are saying, "Oh, the current administration," well, the last administration said you couldn't buy ivermectin, and maybe Kevin knows about this because I want to be corrected if I'm wrong. But I heard I should have checked this before I opened my mouth, but I live on the edge of fear. I heard that the person that developed ivermectin was awarded a Nobel Prize because of what it does for parasites, and it's so unbelievably cheap. Well, and I mean in lots of countries where these parasitic infections they're just horrible. Well, ivermectin knocks them out, and it's dirt cheap and has minimal side effects. Well, because people were saying it's it would treat or cure or prevent COVID. The last administration pulled that right off. You can buy ivermectin in the United States unless you went to a veterinarian or you got this paste and stuff. So let's not tag the current administration for saying how that is so ridiculous. I think every administration does plenty of ridiculous things. Allison, I'm seeing are there some questions? Is that what I'm seeing at the bottom of the screen?
Yes, there
Here's-
were a few.
Oh,
So I
goody.
typed
Let's
those
have them.
into our chat if y'all want to touch on those.
Type it into the chat. Okay. Another miracle has occurred. I actually found that. I've got a question for Dr. Samson Donnelly. Okay, if you have a question. Can we touch on two of the big topics that come up? Topical fluoride is much more effective than community water fluoridation, so fluoride in the water is not needed. That's a good one. Topical fluoride is much more effective than community water fluoridation, so fluoride in the water is therefore not needed. What would you say to that, Kevin?
Well, those are two different issues. I think the reason water fluoridation is important is because of who's drinking it. You know, a lot of people go to the dentist, they get professionally applied fluoride, and that's good, and it's shown to be quite effective. But what about the kids that don't get to the dentist? And probably the only fluoride they're going to have access to is either community water fluoridation or toothpaste that is fluoridated. As far as which one is more important, well, I think I'd have to agree that professionally applied is probably more important. However, not everybody has access to that, as with fluoridated water. And we now have two states. One's your neighbor down below you, Florida, who has pulled water fluoridation, community water fluoridation from the entire state. So ever since I've been around, it's always been a community decision, and the community is who pays for the water fluoridation or who does not. And so when a state tells you that, I guess that's final. You're not going to have it. So that increases the need for you to use a fluoridated toothpaste and see your dentist and get professionally applied topical fluoride.
And for Floridians, I'm going to be speaking in a few weeks from now at the Florida National Meeting, or I should say the annual meeting of the Florida Academy of Pediatric Dentistry. And fluoridation is not on the schedule, either from me or the other speaker. But my comment about that would be since fluoride's taken out of the water supply, and I would think that dentists, pediatric dentists specifically, would be obligated to explain that and say you can buy a fluoride supplement if you choose to do that. Just be careful with how you use it. You have to. I mean, does that have to be a prescription, Kevin? I have no idea.
Well, yeah, it does have to be a prescription, but as we said, actually, I believe it's next week they're going to have a hearing on whether fluoride tablets and liquid will be available in pharmacies. So that may dictate it right there. But like I said, yeah, it's the dentist's responsibility to tell them the benefits. And I think it's their also responsibility to go to the governments, to their state health and human services, insurance companies, and things like that. I think you're probably well aware of the study that came out of Canada where they stopped fluoridating an area and compared it to a control group where it was fluoridated. And after 1 year, they stopped and refluoridated because the caries incidence and hospital emergency room visits went significantly higher because of the non-fluoridated cities. So there's evidence out there.
Now that since that's admittedly not really my game, since I mean I've got a pediatric dental degree and also orthodontics, but this particular thing you just brought up wouldn't actually be in my orbit of consciousness. Would you mind just if you'll email me that reference? Is that I mean, unless it's I would imagine it's not difficult for you to find the one you just said about Canada.
Okay.
Um, if you'll email that to me, you can contact me or you can contact Allison at Fireside to get the reference.
Okay.
Allison, is that okay even if they're not a Fireside member? Are you okay with that? Just you'll just bounce the reference to them, not
Yeah,
the article,
absolutely.
the reference. Is
And if
that
we
good
have the
now?
link, we can send it out with this recording.
Okay, yeah, that would be good.
All
Um,
right.
all right, here's another one. The last one that I'm seeing. Any thoughts on the fluoride quote substitutes like hydroxyapatite or apatite? I don't know if it's apatite or apatite.
Oh yeah. Um, I'll have a comment on this. It's kind of like, do parents ask a lot of you about the charcoal uh, dentifrices, and they try to convince you that it can replace fluoridated toothpaste because it cleans better. There's no evidence of that whatsoever. Um, as far as hydroxyapatite, fluoridated, no, non-fluoridated toothpaste. It's actually had a study done head on head with the fluoridated toothpaste. It did not perform as well. Therefore, it does not have FDA clearance and it does not have acceptance by any professional organization. I think what's so convincing about it, and I've gone to their website, one of them, and looked at it, and it's almost convincing, and I know better. I'm an expert in fluoride, and gosh, they almost convinced me. You're using something that teeth are made out of, hydroxyapatite. Why would you want to use anything else? Well, I guess I have to remind everybody, we all are chemists, whether we want to be or not, because we had to take it to get into professional school. And when you overload a system with calcium and phosphate, it will precipitate to the floor of the mouth. Well, your saliva is already supersaturated with calcium and phosphate. So if you brush with hydroxyapatite toothpaste, basically you're chelating it to the floor of the mouth because you can't super saturate something. It'll chelate out. And so really it is not of benefit whatsoever. And if people insist on using it, you make sure they use it at least 2 or 3 times a day because now you're only looking at the mechanical removal of plaque. And you're seeing no benefit from where the fluoride would have replaced that hydroxyl imperfection and created fluorapatite.
Well, thank you. That was a comprehensive a answer.
Sorry.
No, 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 no. I meant thank you. Seriously, I mean, this reminds me of the psychology of advertising is that maybe you don't remember exactly what was said. You do remember how it was said, and the person saying it was an expert. And that's about all you end up remembering. Reza Ardalan, by the way, just chimed in something. He's a Fireside member and advocate. Extremely well, we did a one of these with Reza that exceptional
Right.
at not only his dentistry but his marketing and his uh, Willy Wonka style personality is
He's
quite remarkable.
great. I
Well,
want him
you
to be
say
my dentist.
yeah, yes, I say one of a kind. There you go. He just said to answer Jerry's question, uh, the person about ivermectin, the guy did win a Nobel Prize in 2015, and he won a Nobel Prize for developing ivermectin 30 years earlier. Uh, and if Allison just mentioned that the session with Reza Ardalan, pediatric dentist, is on YouTube on the YouTube channel, which is, I guess that's open to everybody. Is that right, Allison?
It is, yeah, anyone can go and watch the recordings.
Hey, Al, before we wrap this up for a Friday morning, you were, I don't remember the name of these things that Fireside has started doing that everybody sees in all of their medical offices. What are those things called when you're in the waiting room?
The our point of care screens.
Point of care. So um, that took me a second to understand what that meant, but I think everybody knows because it doesn't matter which physician you're going to, there's something there. Hopefully it's not HGTV only, but it just occurred to me while Kevin was speaking, that would be something to put up about fluoride, an information thing, not an infomercial, pure information that they can look at about the fluoride controversy while the parents are in the waiting room.
Mhm.
I mean, I think that would be really valuable, don't you?
Absolutely, yeah. To give context to what Jerry's mentioning, we are piloting with some of our fireside members here in Birmingham, Alabama, and hopefully we'll be expanding the network, a point of care digital engagement screen. So you've likely, as Dr. Jerry mentioned, seen these in medical. I know I see them about every dermatology visit I go to, just about every other doctor visit. There are screens either in the actual treatment room or in the waiting room. And a lot of times, you'll have a TV in the waiting room. I know for many of you that it serves as a point of entertainment for patients. It's either playing Bluey or what's the big one? I know my daughter loves Bluey, but that is usually an entertainment screen. What we're doing is adding an additional screen that serves as education and information. Some of it is still engaging for the kids. We've got some screens that, you can guess the animal by its teeth. And so we've got, fun interactive games, but we also use the opportunity to share educational content. So flossing, brushing tips, as Jerry mentioned, this could be a great point of education for your patients. That if you are getting lots of questions, getting lots of concern about this subject, you can put information there. So again, this is being piloted right here in Birmingham, but we hope to expand the network soon. One additional benefit is that we use space for local businesses and local community partners to help broaden their audience and their reach. And so there is some advertising revenue that comes back to each practice. So we have a great program where it adds additional passive revenue to a practice in addition to the patient education and engagement. So it's a nice win-win for local businesses, the audience, and usually there's some kind of promotion or discount that patients get that corresponds with the advertisers. So a free donut, which I know again might be controversial to have them go get a free donut right after they visit their dentist.
No, no, we love that. It's like giving candy to them. Here, kid, bulk up. Well,
I mean,
eat
yeah,
the,
it
eat
keeps
them
the repeat
gummies. You gotta
visit.
get them
They'll
gummies,
come
baby.
back. But
But
it is something that helps, I think, that patient loyalty and patient, and the discounts could be anything, a free exercise class, a free car wash. So we're excited to see how it goes in Birmingham. We'll certainly share the results and let everybody know about the next market we're going to go into. But again, it's just a way for us to see what kind of value can we help bring the practice, both in terms of growing their revenue, growing profitability, but also growing that relationship with the patients and your ability to educate and keep patients engaged. So.
so from what you said before we went online um, or on screen or whatever, you said something that, of course, the doctor has a final say so about what
Mhm.
advertisements are put in. And does Fireside, I mean, I find this from a business standpoint, probably when I graduated from my program in orthodontics in 1981, I would have thought, uh, absolutely not. But the whole advertising was not allowed for dentists or attorneys at that time either. When I graduated, that was not allowed. That was out. Well, it's a different game. So I think everybody's used to this. Does Fireside, do they handle placing the screen and doing all the
Mhm.
uh, background work and all the legwork? Fireside does all that?
Absolutely. So I was actually in lots of offices the last month, getting the screens installed, moving electrical if electrical needed to get installed, actually ordering and putting the screen in, not me myself, but I worked with contractors to do that. And then we actually work with the local businesses. And we vet them pretty highly. We want them to be really reputable local community businesses that are locally owned. So it's not, big pharma coming in and putting up an ad. It's which, no knock to big pharma. I'm sure there's a time and place for that. But it truly is meant to reflect and honor the fact that your office and your practice is a community hub. That, you get requests for donating to sports teams and to be involved in the community. And so this is a natural extension of that, we have local businesses that see how valuable and how trusted you are and want to be a part of supporting your brand and your message and do that through using that space for advertising, because they know that, your patients are that's your trusted audience, that's your trusted community. And so there is, I think, a high degree of sensitivity about the brands that would be there. And as you mentioned, every dentist has, I actually worked with one recently who he didn't have an issue with the company itself. It was just one of the images they'd selected. It was a fitness brand. And so he asked, can we use a different image? I just want to make sure this is, as, family friendly. I mean, the image was not bad, but it was,
I'd like to see that image actually. So
it
like,
was,
yeah, yeah,
it was
yeah, probably you wouldn't select like vape shops. They can't
right.
advertise them
No,
yet. No, no
nothing
vape,
like
that
that.
night
Yes.
owl tattoo. That might not be, nah, that probably wouldn't make it in
No
there.
tattoo shops yet. But no, as I mentioned, there is a high degree of sensitivity to the brands, and
Nail
all of them
salons, maybe some nail salon.
are very family friendly, family focused, because that's who wants to be in front of your audience, are brands that and community partners that value, the kind of the millennial mom that is, so typically is probably a big bulk of your audience and the things that they care about. So we really are thoughtful about curating that and give, right of refusal over any advertiser to the practice. So we get
Yeah.
that it's your real estate, it's your brand. So we want to help you engage your patients and create a better, a more engaging experience and generate some more brand loyalty from your patients to you, and then bring you in a little bit of passive revenue.
I I mean, I'm kind of shocked at my own thought process because I would have been opposed to it. I wouldn't have been offended. I would have just said absolutely not. And I'm thinking, well, I don't know. It seems like every office I walk into, every professional office, they've got them. Kevin, uh, I I'm really delighted with that information that you supplied to everybody. I think it's extremely sensible. I think it's very clear and incredibly valuable to the patient families and the people we're responsible for. Any closing comments, Kevin?
Well, I hope people don't freak out on this. Everything has its ebbs and flows. And, I'm old enough to have seen a lot of it go through from bisphenol A being so dramatically bad and things like that. And this will solve itself as long as you follow the science.
Thanks, Kevin. Allison, always a pleasure.
Yes, and we look forward to the next one, I believe is in November, with Dr. Juan Yepes. So there will be information forthcoming about that session. So we will send out the link to register with this recording. Dr. Donley, thank you so much for joining us. It's always a pleasure. Hope to see you at some point again on the circuit. But thank you everyone for joining us. As I mentioned, the recording will be available. So if you had to hop at any point, you can come back and watch the full thing. But we appreciate you for joining us.
And Dr. Yepes, always a tremendous speaker with phenomenal information. He'll be speaking about sleep apnea and related things. So you
I'm
won't want to
excited
miss
for
that
that
one.
one.
Thanks to everybody. Happy weekend.
Bye, everybody. Have a great rest
Thank
of your
you.
day.
I mean, shalom, yo.